Hello everyone, I am Ritika and today I am going to show you um, present some government schemes in front of you. There are some schemes which is run by our government for the welfare of women and for the welfare of uh, for elderly people and for children. So let's see those schemes, and there are some schemes related to health and all. So let's see those schemes. So Mission Indradhanush is a scheme which is launched by Government of India in 2014, and the aim of this scheme is to increase the immunization coverage to children to 90%. Under this drive, focus is given on pockets of low immunization coverage and hard to reach areas where the proportion of unvaccinated and partially vaccinated children is highest. A total of 6 phases of Mission Indradhanush have been completed, covering 554 districts across the country. It was identified as one of flagship scheme under Gram Swaraj Abhiyan and extended Gram Swaraj Abhiyan. While the first 2 phases of Mission Indradhanush resulted in 6.7% increase in full immunization coverage in a year, a recent survey carried out in 190 districts covered in intensified Mission Indradhanush. So this is the scheme which is launched by Government of India to increase for reaching the goal of full immunization coverage. Janani Shisu Suraksha Karikram. This scheme is launched by Government of India for the welfare of mother and the child both. So entitles all pregnant women delivering in public health institutions to absolutely free and no expense delivery, including cesarean section. The initiative entitles all pregnant women delivering in public health institution to absolutely free and no expense delivery, including C-section. The entitlements include free drugs and consumable, free diagnostic, free blood wherever required, and free diet for 3 days during normal delivery and 7 days for C-section delivery. This initiative also provides free transport from home to institution between facilities in case of a referral and drop back home. In 2014, this entitlement extended to all antenatal and postnatal complication of pregnancy. This scheme was extended for those also. Rashtriya Kishore Swasthya Karikram. This scheme was launched by Ministry of Health and Family Welfare in 2014 to ensure holistic development of the adolescent population. The Rashtriya Kishore Swasthya Karikram program defined an adolescent as a person within 10 to 19 years of age in urban and rural areas, includes both birth and both girls and boys, married and unmarried, poor and affluent, whether they are in school or out of school. The program also focuses on reaching out all adolescents, include lesbian, gay, bisexual, transgender, and LGBTQ, to guide the implementation of this program. Ministry of Health and Family Welfare, in collaboration with United Nations Population Fund, has developed a national adolescent health strategy. The 6 thematic areas of Rashtriya Kishore Swasthya Karikram, as well as that of the strategy, are nutrition, sexual reproductive health, substance misuse, non-communicable disease, mental health, injuries and violence. The program, this is the program launched for teenagers basically. The prime element of the program is adolescent-friendly health clinics across various levels of public health institutions in all states, weekly iron folic acid supplements program for school-going adolescents, boys and girls, and out-of-school adolescent girl across the country, peer educator program. Uh, in select 200 districts based on composite health index and identified as a high priority district. The menstrual hygiene scheme that provides funds to the state procurement of sanitary napkin for adolescent girls aged between 10 to 19. Janni Suraksha Yojana is a safe motherhood intervention under the National Health Mission. This scheme was launched by Government of India in 2005. It is being implemented in all states, and this scheme is implemented in all states and urban territories with special focus on those state low performing states like yeah, the states low performing states means those states which in which maternal mortality is high and yeah, in maternal mortality is high. So these things. It was launched for reducing maternal and neonatal death to promote institutional delivery. So neonatal death, uh, so under neonatal deaths, those death comes under neonatal deaths which are under 29 days uh, after birth. Death under 29 days of birth. I think this comes under neonatal. Yeah, this comes under neonatal death. So this program take care of uh, pre-neonatal and post-neonatal and all. Cash incentives under the Jani Suraksha Yojana, eligible pregnant women are entitled to cash assistance irrespective of the age of mother and number of children for giving birth in a government or accredited private health facility. Area of focus: the scheme focus on poor pregnant women with a special dispensation for states that have low institutional delivery rates, and those states are Uttar Pradesh, Uttarakhand, Bihar, Jharkhand, Madhya Pradesh, Chhattisgarh, Assam, Rajasthan, Odisha, Jammu Kashmir. While these states have been named low performing states under the scheme, the remaining states have been named high performing states. The scheme also provides performance-based incentives to women health volunteers and like women health volunteers ASHA for promoting institutional delivery among pregnant women. प्रधानमंत्री सुरक्षित मातृ वंदना अभियान program. The प्रधानमंत्री Surakshit Matru Abhiyan was launched by Ministry of Health and Family Welfare, Government of India. The program aims to provide assured, comprehensive and quality antenatal care free of cost universally to all pregnant women on the 9th of every month. So this is the you can read from here. The program follows a systematic approach for engagement with private sector, which include motivating private practitioners to volunteer for the campaign, developing strategies for generating awareness, appealing to the private sector to participate in the Abhiyan at government facilities. This is the scheme which is launched by Government of India. Navjat Shisu Suraksha Karikram. This was also launched by Government of India. So these are the things you can read from here about this scheme. Mother's Absolute Affection Program was launched in 2016 by Ministry of Health and Family Welfare to promote breastfeeding and provision for counseling services for supporting breastfeeding through health system. The program has been named MAR to signify the support lactating mothers require from family members and at health facility to breastfeed successfully. The following are the objectives of the program: build an enabling environment for breastfeeding through awareness generation activities targeting pregnant and lactating mothers, family members, and society in order to promote optimal breastfeeding practices. Breastfeeding to be positioned as an important intervention for health services and development. reinforce lactation and support services at a public health facilities through trained healthcare providers and through skilled community health workers, to incentivize and recognize those health facilities that show high rates of breastfeeding along with process in place for lactation management. Vatsala Matri Amrit. So this is the scheme also launched by Government of India. Integrated Child Development Scheme. This was launched by Government of India in 1975, and it is a centrally of course this was launched by Government of India, and this scheme comes under Ministry of Women and Child Development. So these are the objectives of integrated child development services: to improve the nutritional and health status of children in the age of 0 to 6 years, to lay the foundation for proper psychological, physical, and social development of the child, to reduce the incidence of mortality, morbidity, malnutrition, and school dropout, to achieve effective coordination of policy and implementation amongst the various departments, to promote child development, to enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. Integrated Child Development Scheme provision and seed services uh, will provide the following six services: supplementary nutrition, health and nutrition checkup, immunization, non-formal education for children in preschool, health and nutrition education referral services. National AIDS Control Program. So this was launched by Government of India in 1992. Is So this was launched by for the prevention and control of HIV and AIDS in India. Over the time, the focus has shifted from raising awareness to behavior change, from a national response to a more decentralized response, and to increasing involvement of NGOs and uh, networks of PLHIV. The first phase focused on awareness generation and setting up a surveillance system for monitoring HIV epidemics, measured to ensure access to safe blood and preventive services for high-risk group population. So this program is launched by Government of India to spread awareness about AIDS and all. And yeah, so this is the scheme which is launched in 1982. There are many phases of this. This is cigarette and other tobacco products. So this was launched by a Government of India in 2003. Uh, in so this for uh, the main objective of this scheme is to bring about its greater awareness about the harmful effect of tobacco use and tobacco control laws, to facilitate effective implementation of tobacco control laws. The objective of this program is to control tobacco consumption and minimize the death caused by it. The various activities planned to control tobacco use are as follow: training and capacity building, ICE activity, monitoring tobacco control law and reporting, survey and surveillances. So midday meal scheme, this was launched in 1925. So this was launched by government, state government, and central government for increasing gross enrollment ratio in schools, and also for minimizing the malnutrition also, which was very common in the school going poor children. So the main goal of government is to increase gross enrollment ratio in schools, and also to provide nutritious food to school going children. So in 1925, the Madras Municipal Corporation introduced this scheme. It provided free lunches to disadvantaged children attending government or government aided schools in their jurisdiction. By the 1980, the scheme expanded to Tamil Nadu, Kerala, Pondicherry, With time, several states in India adopted the scheme. It led to its implementation in various parts of the country. To implement the scheme on a national level, the Government of India introduced the National Program of Nutritional Support to Primary Education on 1995. It was later named as National Program of Midday Meal in Schools. Nowadays, it is commonly known as Midday Meal Scheme. So, so these are the objectives of uh, Midday Meal Scheme. So yeah, to enhance enrollment, retention, and attendance of children in primary education, to improve the nutritional level among school-going children, to reduce the gender gap in education and nutrition, to foster equality among children by removing the caste prejudices. So there was a caste prejudices also. Uh, government launched this program to for eliminating those social uh, problems, and for tackling the social problems also when everyone is eating together. So these things will take time. Uh, these schemes will work in a um, in an efficient manner to foster equality. National policy in older person. So this was launched by Government of India in 1999. The policy investigates so to support financial and food security, healthcare, shelter, and other needs of older person, equitable share in development, protection against abuse and exploitation, and an availability of services to improve the quality of their lives. Rashtriya Vayosri Yojana. It is a central sector scheme founded by the Senior Citizen Welfare Fund. The scheme provides aids and assistive living devices to senior citizens belonging to BPL category or those earn less than 15,000 per month and suffer from age-related disability. So this scheme is for those Rashtriya Vayosri Yojana. So those people who have some kind of disabilities like low vision, hearing impairment, loss of teeth and locomotor disabilities. So this scheme is for those. Mainly it was launched by for the welfare of senior citizens. So this is the national helpline number and all. Atal Vayo Abhyudaya Yojana. The ministry has also included awareness generation, sensitization programs with school colleges, students for strengthening in intergenerational bonding under the umbrella scheme of Atal Vayo Abhyudaya Yojana. This is the scheme. Reproductive Maternal Newborn Child and Adolescent Program 2013. In India, this program was launched in 2013 to address the major causes of mortality among women and children as well as the delay in accessing and utilizing healthcare and services. Since the rollout of RMNCH plus a program, India's maternal mortality has fallen. So these are the advantages of this program. Uh, a reproductive and child health survey was launched in 1997. So this is the main objective of this scheme. You can read from here. And reproductive child and healthcare for second page was launched in 2005. Reproductive maternal childhood and health care. So this was launched in 2013. Ayushman Bharat scheme is launched by Government of India in 2018. Uh, So this was launched by Government of India by the recommendation of National Health Policy 2017 to achieve the vision of universal health coverage. It has two interrelated components: Health and Wellness Center and Pradhan Mantri Jan Arogya Yojana. Pradhan Mantri Jan Arogya Yojana is the world's largest health insurance assurance scheme, fully financed by the government, launched in February 2018. It offers a sum insured of 5 lakh per family for secondary care as well as tertiary care. So these are the things which comes under this scheme. So this scheme is for those who are who belong to socio-economic uh, socio-economically weak section, like weaker section, those who are economically weak. So the nodal agency, health authority. So this is the nodal agency and all. You can read from here. So these are some challenges of this. Um, State is a health is a state subject, and states are expected to contribute 40% funding for this scheme. It is critical to streamline and harmonize the existing state health insurance scheme to be this burden of costs are contested area between the care provider and the center, and many for profit hospitals see the government proposal as unviable. So this is the National Health Mission. So this is the objective of National Health Mission, to reduce total fertility, reduce it to 2.1. Like 2.1 is a replacement level. I think India's total fertility rate, according to SRS report, recent report, it was 1.9, and there are some states which are above 2.1. That is a replacement level. So there are like Bihar up 2.9, and all. Bihar, and reduce infant mortality rate to 25. So according to there are some states which have high total fertility rate, like Chhattisgarh, Uttar Pradesh, Madhya Pradesh. So these are some states till they like 36, 35. These are the infant mortality rate of these states, and national average is at 25. I think 25 and all, and Kerala has the lowest infant mortality rate. Maternal mortality rate reduce it to 1 per 1,000 live birth. I think currently, yeah. So these are the objectives of National Health Mission. Rights of Person with Disability Act 2016. This was launched in 2016. The types of, so this is the all which comes under this. United Nations Convention on the Rights of Person with Disability. So you can read from here. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. So these are the all things which comes under this. There are two types of disease. Some are non-communicable and communicable. Some diseases are communicable, like coronavirus. That is a communicable disease. if we come in contact of someone who have that disease, then it may be possible that I am also going to be diagnosed with that disease. So that disease is communicable. But some diseases are not communicable, like heart disease. Even if I come in contact with a person who have a heart disease, the chances of uh, so there are 0% chances that I am also going to be diagnosed with that same disease after uh, coming in contact with that same person, the someone who have that disease, like who have heart disease. So heart disease comes under non-communicable disease. All the disease like so heart disease, cancer, these are not communicable disease. These are non-communicable disease. So yeah. National Mental Health Program was launched by Government of India in 1982. So these are the all things which comes under this. National Telemental Health Program was launched by Government of India in 2022. Ayushman Bharat scheme is launched by Government of India in 2018. Thank you so much for listening me. Bye. Good night.